All right. Hello, everyone. Just before we begin today, just want to confirm that everyone can see the slide and can hear me okay. And if you give a thumbs up, or I'll try and open up the chat to see. Perfect. Thank you, Kathy. Just organizing my screens a little bit here. Where'd that go? Perfect. Okay, so we'll get started in about a minute or so. I just want to give everyone enough time to log in. I've seen a few familiar faces and names actually on the registration list. So great to see you again and connect with you again. And for everyone else that we haven't connected yet, I'll be introducing myself in a little bit, but just a quick little introduction. I'm Dennis Larson, one of the members here, or team members at Ergonomics, and I'll give a kind of more detailed introduction as we get into the webinar. Okay. Perfect. Starting to see those numbers come up. All right, so we'll get into kind of the webinar a little bit here. So welcome to our webinar series for 2026. Here we are aiming to provide a free webinar every other month as our way of giving back to the health and safety and ergonomics community. With the webinars that we are presenting, we are trying to provide some context and some information about the world of ergonomics and how it can fit into the existing programs, the ergonomics programs, the health and safety programs, how it can all fit into your current organization's programs to kind of build out a more holistic ergonomics and MSD prevention program. But as we go through today's webinar, I'm going to say feel free to pose any questions in the chat. I'll try to keep monitoring that as we go through, answer them as we go. I will have it open on my screen, but it keeps kind of resetting to different views. So I'll try and keep my eye on that. If I see any questions, I'll try to answer them as we go along. I'm also planning on leaving some time at the end of the webinar to go back through and look at the chat to see if there's any questions there. And if for any reason there is a question that is a bit more in depth and requires a little bit more kind of research, resource digging to get that information to you, we will keep those questions in a little repository for the end and send out our answers and resources that we gather to answer that question after the webinar. And that'll be sent out to everybody. So getting to a little bit more about us before we begin. Just want to spend a bit of time introducing who we are and what we do at Pro Ergonomics. So here at Pro Ergonomics, we assist clients with their ergonomics and health and safety needs, primarily focusing in on the ergonomic practices. We do occasionally do some health and safety audits, some job hazard analyses, but all of our staff are certified professional ergonomists and associate ergonomists, and we work specialized in the ergonomics field. But our overall goal is to help you get your systems and workplace running at peak productivity with ergonomic practices and principles in mind. So we try to stay on the leading edge of kind of the research and up and coming new ideas in the field and keeping up to date with some of those technologies and equipment and research. So there's been exoskeletons, AI is huge right now. And today's topic is one of those up and coming fields of interest that is I see a lot more of in the ergonomics field. So we try to keep up to date with them, share that information with you, and we apply the new information, equipment, and tech when and where we see fit, and where we see benefits to you and your ergonomics and health and safety needs. Now, sometimes this is not always the best solution, but we always try to stay up to date with what is new and upcoming. So again, one of the topic today is kind of new and upcoming, and why we're here to help is produce or introduce some of that information to you. And our overall goal as a company is to support you and your clients for improving your ergonomic processes through reducing injury risks and increasing productivity, and ideally in a proactive manner before any issues and problems arise in the workplace. So that is our mission. And with all of this in mind, I kind of wanted to share with you some information about that topic of mental health and psychosocial factors that I have seen some growing interest with more and more research coming out within the ergonomics community. At all the recent conferences and network events I've been to, there's always been some aspect of psychosocial factors and mental health in presentations and in the research that is being presented. So I tried to gather up some information to share that with you today. So the topic for today's webinar is how mental health and psychosocial factors are related to ergonomics principles and how they have a role in musculoskeletal disorder or MSD prevention. But before I get into the content, I just want to briefly introduce myself before I forget. Um, my name is Dennis Larson. I am one of the ergonomists here at Pro Ergonomics. I do this work to promote health and safety and well-being in the workplace. And I also do some work at the University of Waterloo in some research surrounding occupational health and well-being. And so trying to keep both of these fields and merge all this technology and new information together is kind of part of my passion within the ergonomics field to promote health and safety and well-being in all aspects of daily living. So just to get started, here's a quick outline for today's webinar and meeting. So I'm going to walk through a bit of background information about the psychosocial factors, how they relate to injury, look at or introduce the 13 psychosocial factors that have been introduced, but then talk about specific factors, then how they relate to classic ergonomics MSD risk factors, like force, posture, repetition. So those are the classic three that we always think of in the physical sense, but these mental health and psychosocial factors also relate back to those. And I'm going to try to show you and link those factors back together for you. I'm also going to highlight why psychosocial health and safety is important in the workplace, and finish off with sharing some tools and available resources to evaluate psychosocial risk factors and how we can help implement and incorporate some of these processes into your programs and awareness, or to increase awareness of psychosocial factors in your workplace. So yeah, that's a quick overview of what is happening today, or the outline for today's webinar. And I'm going to start off with saying that mental health and psychosocial injuries are one of the fastest growing injury claims categories that we are seeing. So looking at WSIB data in Ontario, we still see that strains and sprains are the number one nature of injury within the workplace. So these are related to your classic MSD risks. We see a consistent average of approximately 25,000 claims per year, and there's an average lost days of about 39 days, with the total or average cost per claim being around just over $8,000. So we're seeing this consistency across MSDs. We're not seeing an increase, we're not seeing a decrease. One of the things that we're seeing within the data now is this mental disorders and syndromes category, we're seeing this drastically increase. Now, if we look at this data here, kind of start off around 600 to 700 claims per year in 2012, 2013. And it wasn't until 2015 where we started to see this category become into the top 10 sources of injury claims within the workplace. And since that time, and since the data has been captured and being tracked, we are seeing an increase of almost 250% in the amount of injury claims associated with mental disorders and syndromes in the workplace. Now, the total number may be lower than the sprains and strains injuries, but what is key and what I want to kind of highlight the importance here is that the average days lost associated with a mental disorder and syndrome injury claim is 432 days, so over a year compared to just over a month with MSDs. And the average cost per claim is over $80,000, so 10 times as much as a strain and sprain injury. So this is incredibly important for us to be aware of. And specifically when I start relating these mental disorders and syndromes and psychosocial factors back to MSD risks in the traditional sense. So just to kind of highlight the importance of these mental health and psychosocial claims and injuries that are fastly growing in the workplace. Now, trying to link these psychosocial factors back to MSD risks, just kind of give a brief definition here. Psychosocial factors refer to the non-physical demands of the job. Now, according to quoting from Guarding Minds at Work, psychosocial factors are elements that impact employees' psychological responses to work and work conditions, potentially causing psychological health problems. So again, we're relating back to the non-physical elements and demands of the job. But what this is kind of pointing out is that psychosocial factors can affect the mental health, and there's also they affect the work conditions and can change or increase the risk for developing musculoskeletal disorders. Now, when we think about overall health, we often think about physical health in itself. We obviously in ergonomics, we large focus over the last few decades has been on the physical factors, the force, posture, and repetition. But we're seeing a growing number of research articles coming out that are highlighting the links between psychosocial factors, mental health disorders and syndromes, and linking that to the physical MSD risks within that we're seeing in the workplace. And want to highlight here that mental health and safety is just as important as physical health and safety. And balancing the two is key to promoting overall health and well-being in workplace, but not just in the workplace, in life in general. So this is something that is, like I said, a growing area of interest in the ergonomics field, and definitely important to consider in the workplace. Now, I've been talking about the kind of risk factors for MSDs and injuries. So we have the classic physical risk factors of force, posture, repetition, awkward postures, sustained postures. And we have the kind of modulating factors of vibration, hot and cold temperatures, contact stresses, modulating these physical risk factors. But what I want to highlight here is that there's an additional 13 psychosocial factors that have been highlighted and categorized into, or that have been linked to MSD risks and injuries that need to be considered in the workplace. So just kind of briefly, these categories include psychological support, organizational culture, clear leadership and expectations, civility and respect, psychological competencies and requirements, growth and development, recognition and reward, involvement and influence, workload management, engagement, balance, psychological protection, protection of physical safety, and that rounds out the 13. Now, some of these may be more related to MSD risks than others, and I'm going to highlight that in the upcoming slides. But if we kind of link these two together, you when you have an increase in physical risk factors or an increase in psychosocial risks, what you see is kind of this overall stress response in both scenarios. For example, if I'm going to be talking about workload management in the upcoming slide, but if you have a heavy workload and are rushing and not taking breaks, you end up having no rest. You have an increase in muscle activation and temperature. You could be feeling more stressed, increased blood pressure. All of that kind of relates back to increased MSD risks. And there's also this cognitive element or emotional element where you are frustrated with the workplace, or you may be experiencing some pain sensitivity, but you're not able to change the workplace. All this kind of leads to this building stress response that impacts the overall health and well-being in the body. So this is kind of drawing the link between the physical risk factors and the psychosocial. And I'm going to walk through a couple examples now of where I see direct links between specific psychosocial risk factors and MSD risks. Actually, before I get into that, I just want to quickly look at the chat, see if there's any questions. Yeah, don't see any. Perfect. All right, we jump back into it now. So, like I said, I'm going to try to go through a few examples here of linking psychosocial risk factors to ergonomic specific MSD risks. And the first one I'm going to talk about is workload management. If it pops up, there we go. So, and according to kind of by definition, workload management is, in the sense of psychosocial risk factors, is the work environment where tasks and responsibilities can be accomplished successfully within the time available. So, in a productive or a kind of when you have an environment where there's good workload management, you're able to work at a comfortable pace, complete tasks within time. You're not having to work overtime or anything like that to get jobs done. But in a sense where workload managed or the workload is very, very high, the pace is very high, there's a lot of time pressures, there's a lot of intensity in the work, there's a lot of competing interests and multiple tasks being performed. That can promote this stress response, and it could lead to rushing and skipping breaks, and making mistakes and errors, redoing work overtime, building up these stress responses that I was just talking about. Um, and in terms of relating it back to specific ergonomic risk factors, at least in the physical sense, the repetition, if that increases, you're doing faster work, you're not getting enough rest. That leads to decreases in tissue tolerance and injury over time. Again, linking that back, you get lack of recovery, fatigue development, tissue tolerance goes down, and then injuries start to increase. And sometimes when you have to get things done fast, you apply more force. Uh, Thinking about trying to push a cart from one side of a shop to another. If I need to get there fast, I'm going to start pushing that with more effort to get it going faster. That leading to increased force on the body, and doing that over and over again, again, could lead to some increases in these physical MSD risks. The next kind of section I kind of want to talk about is going to relate to this idea of job control. Then I have two categories I'm going to highlight here related to job control. It's going to be influence and involvement, as well as psychological protection. So, first off, influence and involvement, as defined, is the environment where employees are included in discussions about how their work is done and how important decisions are made. So, when we think about this in the terms of our workplace, when people are involved in decision making or have an influence in the decision making process about how the work is completed, they are usually more satisfied with their work, they're more committed to their work, they have some sort of locus of job control. And when they're involved and committed to their work, if you get this sense of working together to come up with creative solutions that put the worker first. So a key in ergonomics is fitting the job to the worker. So if we put the worker in mind, we can come up with creative solutions to fit the job to the worker. Now, when the workers are not involved in this process, and more of it's just decisions are being implemented in the workplace with no consideration for how the work is being done or having any feedback from the workers, the the experience and have a lower locus or lower feeling of job control. And because of this, they may feel like and maybe actually unable to change the way they work. So if they're not involved in the design process and discussions, they may not be able to provide feedback on what is working well, what is not working well, not be able to adjust their pace, their setup, their postures, and that just kind of leads to an increase in MSD risks overall. Now, jumping to the second part that I mentioned here is psychological protection. And this is defined as an environment where psychological safety is ensured and employees feel able to put themselves on the line or ask questions and seek feedback and report mistakes and problems that they see on the lines or in their workplaces and work to or and can propose new ideas without fearing negative consequences about their job or their career. So they feel like they're able to come forward in the workplace and they're not fearing that if they do, they're going to lose their job. So a workplace where workers feel safe in sharing ideas and asking questions and reporting mistakes and report problems that they may have seen or have done on the work site without being afraid that something bad may happen or something negative may happen to their job in the workplace. That models good psychological protection in the workplace. Now, if the opposite were true and the workers were fearful or anxious about reporting mistakes and problems and hazards and are not encouraged to share ideas and ask questions about their workplace, this creates situations where the problems and hazards go unreported and uncorrected. So if we bring all of these or both of these factors together, we get a sense that if employees are not involved in the decision-making process, or if there is a lack of involvement there, and the workplace is not promoting this psychological safety and they're fearful and anxious about work, a lot of problems or a lot of issues that may happen on the workplace that may be unsafe may go uncorrected and or even unreported. So you may not even know about them until something happens in the workplace, or an injury claim comes through, or an injury happens. So all of this to say is that there's a low job control, the ergonomic risk factors that may happen on the work site of seeing poor or awkward postures when doing work due to workstation setups not being optimal, forceful exertions, high repetitions. All of these things, if they don't go identified or if they're not encouraged to report some issues that they see on the work site, we again see this increase in MSD risks in the physical sense. So they're linking that back there. Now, if thinking about an example here when of workplaces I've been involved in, if someone thinks that maybe an object that they need to move is too big or heavy or awkward to move by themselves, but are afraid to ask for help or being pressured to get it done quickly. Um, for example, I have a customer service example where they have to get the product out the door as fast as possible. They may be exposed to increased and potentially unnecessary MSD risk that could have been avoided if there was an environment where psychological protection uh, and was at the forefront in their workplace. So All of this, these two kind of link back to job control and linking them back to ergonomic risk factors. There's a couple more that I want to share. I'm just gonna look at the chat to see. No questions. Okay. So jumping to kind of the last two that I want to share that have what I see as more direct links to MSD risks. The first one I'm going to share is protection of physical safety, and this is a little bit more obvious, but it's kind of where the work environment where management takes appropriate action to protect the physical safety of employees. So this is related directly to the physical hazards and risks in the workplace. So your force and your posture and repetition, a workstation design, setup, make sure you have the proper tools and equipment that to use to complete the task, etc. So if this is promoted in the workplace, it is directly related to reducing the physical hazards and risks in the workplace. Another one that I think directly links to this is the organizational culture, and I think this also ties back to the previous slide as well. But it's the degree at which the work environment is characterized by trust, honesty, and fairness. Now, that may be a little bit broad in sense of definition, but this is more related to the response to unidentified hazards within the workplace. So, kind of thinking back to the psychological protection idea in the previous slide, if you have an environment where hazards are brought forward by workers, that is great. Now, if there's a culture that this response to these identified hazards in fields is not supported, where maybe productivity is prioritized over safety, or again, like linking back to the psychological protection piece in the previous slide, you may end up getting a sense that yes, there's being reported, it's noted, but nothing is being done because there's productivity slowdowns and getting the equipment changed over and all of that. So this related directly back to an increase in the ergonomic MSD risks. So one, if the physical safety is not supported nor hazards and risks are addressed, you end up increasing the physical have an increase in the physical MSD risks. Now I've highlighted 5 different categories of the 13 here that I think kind of have more influence on MSD risk. But again, I believe that all of the 13 categories in some aspect have an aspect where there's an increase in stress response or feelings of anxiety, and that stress can build up and increase your muscle tension, increase your overall blood pressure, changing the way you work in a sense where you are increasing the movement speed. You're not taking breaks to recover from the work that is being done. So all of that is to say that I think that all of them have links to back to MSDs, but there are certainly some aspects that relate directly to the physical MSD risks more than others. Okay, so I hope that provided a quick overview of kind of how I think the psychosocial risk factors are linking to ergonomic risks. There's a lot of research being done exploring the direct links. This research is still in its infancy, but it's really important for us to consider. And just kind of to talk to that point, there's a lot of scientific and practical evidence demonstrating the impact of psychosocial risk factors on MSD risks and overall well-being. And the impact can be both positive and negative. And I want to quickly pause here because I went to a conference last fall called the Prevention of Work-Related Musculoskeletal Disorders. And this is an international conference that was held in Germany. And there's a group of researchers that's collaborating from the Scandinavian countries, Denmark and Sweden, all the way to Australia. And they're collaborating on this idea of a new Goldilocks work paradigm. So I learned about this during this conference. Again, this is another area of research that is still very much in its infancy, and I'm very interested to see where it goes. But This group is presenting an alternative work job design framework that aims to optimize the health and productivity and capacity of the workers by finding the quote unquote just right balance of work activities, whether that is both physical and mental. So avoiding excessive strain or on the high end or on the low end being or understimulating and sedentary behavior. There's a too much, too little approach being used here, similar to the Goldilocks and Three Bears fairy tale. So they're taking more of a holistic systems approach to address the design of challenging work to the overall health and well-being of the worker. Um, and the idea here is that they're incorporating overall health, both physical and mentally. They're trying to design workplaces that stimulate the worker to promote a positive overall health instead of just thinking about reducing and eliminating and cutting to reduce injury and harm. So they're proposing that for many physical and mental risk factors and psychosocial risk factors and elements, that there's some sort of level of exposure that's desirable and positive for overall health. So that this idea of too much or too little may have the opposite effect and be detrimental. So there's a lot of interesting work happening in this field, trying to incorporate psychological health and safety and promote overall health and well-being. And this idea of using work to promote health instead of promoting health outside of work and just work as work is an interesting area that I'm interested in continue following. But anyways, yeah, sorry for the kind of brief little um, tangent there, but like I said, this work is interesting. There's a lot of things to balance, and I'm going to be following along to see how it works. But all that to say is it brings me back to this point that there's this evidence that psychosocial risk factors can have a positive and negative effect on MSD risk and overall well-being. And coming back to the importance overall, um, it's also important because it supports basic human rights and needs. So dignity and respect, security, integrity, and autonomy. So you get the feelings of self-worth and self-esteem, inclusion. You get your feelings of the physical and psychological safety in the workplace, as well as organizational justice. So respecting that you're part of a community and your thoughts and feelings are being respected and are helping to promote a positive work environment. And lastly, like current and emerging regulations and mandates are articulating that responsibilities of employers are they're providing frameworks, is what I'm trying to say, of for employers to provide a healthy and safe work environment, both in the mental and the physical sense. And there's a lot of different resources out there, and like I said, regulation and mandates coming out that help promote that. So just to highlight here some of the importance of psychological health and safety. But and jumping now to what can we do to help? What can we do to improve psychosocial awareness in the workplace? Um, One of the key things that we can do that we can help out with is performing cognitive demands assessments. Now, for those of you who may not know what cognitive demands assessments are, basically it's an objective and detailed evaluation of the mental, emotional, and psychological skills required to perform a job's tasks. So it's objectively documenting the cognitive demands and requirements of the job. And there's the various categories that we try to fill in and determine the level and severity of which these elements fit into everyday work. Now, these assessments they provide clarity related to the level and the frequency and the complexity of the overall cognitive and mental demands that are associated with the work that you perform. And this document also helps. Um, look at the job requirements for return to work accommodations, specifically with workers with cognitive and behavioral limitations. Now, these assessments, like I said, they revert to job descriptions, um, performance reviews. They are interview based, and they can be easily accomplished over virtual meetings, accomplished over virtual meetings. But it's also what we're doing now is we can also integrate them in with a physical demands assessment to perform a job demands analysis. So we're doing the physical and the cognitive all together. Um, and if we could do this to all of our PDAs, we can have that um, one document that covers both the physical aspects of the job, the cognitive and mental demands aspects of the jobs. So whenever there is health and injury claim, and one specifically associated with psychological or mental health claims, you have that information there with you. So that is something that we can do to help support um, assessing the cognitive demands of the jobs in the workplace. And I mentioned talking about return to work. Now, we can use these documents to achieve a successful return to work program and support the employee from employee getting back into the job. But with uh, cognitive limitations, it may not always be as easy as the physical. Like I said, going back to one of the first slides, there's a lot more complexity with cognitive and psychosocial injuries in the workplace, and the length of time for those injury claims tend to be much longer. So there's a lot more complexities there. But a key to help support successful return to work is to have these assessments in place and have as much objective evidence of the overall job requirements to help the employee and their medical professional and you decide where there's a good fit and decide and determine where there's a good fit in the workplace. Um, and if needed, determine any accommodations or modifications required to allow the employee to get back to work. And if there is any accommodation or modifications, you can develop return to work plans and gradually introduce them back into the work environment. So this is one of the key areas where um, we can help support the psychological or psychosocial awareness and mental health in the workplace. Another area is through kind of job coaching support. So in line with the return to work, this job coaching support, the overall goal is to educate workplaces and individuals on safe work practices and body mechanics. So this is just to help prevent injuries or re-injuries in the workplace, support healthy, safe work practices, provide support for individuals, like I said, returning to work. It helps to promote a safety culture in the workplace. So going back to promoting physical safety and psychological protection and all those psychosocial factors there is a link back to job coaching and providing and increasing awareness for these psychosocial factors in the workplace. Um, Sometimes these job coaching activities identify barriers for return to work or recognize areas where changes need to be made to the job, the task, or the equipment. So sometimes when you're going through this and you're working with the employees and the workers, you get an idea of, oh, this may not be working well. We need to make adjustments here to improve the overall workstation design or improve the equipment that is being used to reduce the efforts that are needed to complete the job. Now, the various ways that job coaching can happen, they can do it in office format, you can do it in group training, you can do webinars, workshops, lunch and learns. You can do it one-on-one instead of group settings. You can do it on the fly. So if you see some going through the work area or see something, you can do on the fly job coaching. And that also just helps to, again, incorporate this idea of promoting a healthy and safe work culture, not just physically, but also mentally as well. So these are a lot of different ways that we can implement and use or can increase awareness for these psychosocial factors in the workplace. And on top of this, there's also a lot of uh, assessment and management tools available. So kind of quickly going through a few of them here. In terms of the just psychosocial assessments only, there is the Copenhagen Psychosocial Questionnaire or COPSOC. So just kind of quickly going here. It's a program where there's a survey based. There's a short, middle, long versions of these surveys um, that are used for different purposes. But idea is to assess the psychosocial conditions and health promotion in the workplace. So going through all the questionnaire or all the survey questions, you'll get an idea of the overall psychosocial conditions and health promotion and be able to determine what are the next steps required to improve that in the workplace. Another resource that is physically psychosocial only is Guarding Minds at Work. So this is basically kind of like an 8-step plan to ensure that your organization is not only ready to implement the uh, kind of actions towards improving psychosocial risk factors, but also sets you up for success when you launch a survey. So you kind of start off with understanding the different factors. So it'll take you through all the 13 different factors that I talked about today. Determine the best assessment strategy for your workplace, which then allows you to create a plan, launch surveys specific to your needs, and then overall review the results and take some action. So there's a step-by-step process that you can go through, and these are all kind of free resources that you can use. Another one is Stress Assess through the Occupational Health Clinics of Ontario Workers. This is a survey that is based on the COPSOP questionnaire that I talked about just a couple slides ago, but it has been adapted for the Canadian workplace to address the concerns in the Canadian workplace. So this is a good resource here that you can go to assess that. And again, it is survey based. Some other ones that are kind of more psychosocial and physical assessments in the workplace. One that I've used before in kind of research terms is the NASA TLX or Task Load Index. It has 6 different categories that allow you to look at the overall mental, physical, temporal demands, the overall effort and performance levels that you experience in the workplace, and levels of frustration. So you kind of get an idea of the a quick idea of the physical and mental slash psychosocial demands in the workplace. So it's a very quick tool. Another one that I don't have a link to is the Dutch musculoskeletal questionnaire, which is a lengthy questionnaire of 63 questions that look at various musculoskeletal workload and environmental factors in the workplace. So again, combining the physical and psychosocial elements together. Looking at more on the kind of management side, looking at a Canadian safety standard called Psychological Health and Safety in the Workplace. That is just a standard that specifies the overall requirements for more of a systemic or systematic approach to developing and sustaining a psychologically health and safe workplace. So there's a lot of information in there. Other tools, I'm gonna skip over one for now, but looking at the risk management assessment tool for manual handling, or RAMP, provides an in-depth analysis and assessment of the physical ergonomics risk factors when working with the manual work. And there's a small section regarding the psychosocial risk factors as well. So it's not comprehensive, but there is some inclusion of these psychosocial factors in there as well. And then there is the psychological or psychosocial risk management excellence framework, or PRIMA EF. And this aims at providing employers, experts, policymakers, um, unions with a comprehensive framework for increasing awareness and promoting psychosocial management at the workplace. And the last one I'm going to do, or kind of mention here, is the A-firm tool, or participative hazard identification and risk management tool. And this is, again, a free toolkit that you can use looking at the physical and the psychosocial risk factors and hazards in the workplace. So it's targeting musculoskeletal and stress-related mental health problems. And this is completed by researchers down in Australia. So there's a lot of different tools available out there, a lot of interesting research coming out. But these are some available assessment management tools available for us to use. In addition to this, there's also some free online resources. So you can go through the MSD Prevention Guideline of Ontario. If you go into the resource library, they have some information on psychosocial factors, MSDs, and mental health. I mentioned already the Guarding Minds at Work. You can go there for an online resource. With the Canadian Mental Health Association, specifically Kelowna, it outlines the 13 psychosocial factors for psychological health and safety in the workplace. That is closely related back to Guarding Minds at Work, but it's just another resource available to you. The Canadian Centre of Occupational Health and Safety has some mental health and psychosocial risk factors in the workplace. Has a document there for that you can review and get some more information on. And then, like I mentioned, the CSA standard is a long, detailed document that has a lot of information in there that helps promote and prevent psychological health, or promote psychological health and safety in the workplace, and prevent these injuries and claims from occurring. So with that, that brings me to the end of the content of this webinar. I hope that was informative, provide a lot of resources, information that you can take with you and take and start implementing in your workplace. And with that, I'm going to just kind of close it off and open up the floor to any questions. I haven't monitored the chat recently, so I'm going to open that now to see if there's any questions coming in. But I want to thank you all again for listening and taking the time to be with us today. Like I said, this is an up-and-coming area of research and interest in the ergonomics field, and we wanted to share some information with you to kind of keep you at the forefront of your ergonomics and health and safety practices. So thank you again. Thank you all for being here, and thank you all for listening. If there's any questions, please feel free to throw them in the chat, and I'll monitor them. But I don't see any questions popping up. So if you do want to or need to head out, have a great day. Thanks again for being with us. Like I said, we would like to promote a free webinar every couple of months to kind of say thank you to the community for all their work in ergonomics and health and safety practices. Have a great day, everyone.